3 News Now Web Extra.
Hi, everybody tuning in. Jennifer Griswold here. We are live on the 3 News Now Facebook page, and I'm joined by representatives from the three major healthcare systems in the Omaha area to talk about how COVID-19 is impacting healthcare workers as well as how it's impacting our community. And we wanted to do it in this format because we want to know what questions you have. And we truly have a breadth of information and expertise among us right here. I want to introduce everyone. First of all, we have Tim Horty, who is a service leader of critical care unit at Methodist Hospital. We have Dr. Vivekanandan. Did I say it right?
Yes, you did.
Okay, thank you, Dr. V. She's an infectious disease expert with CHI Health Creighton. And then we have Becky Long, who is a lead nurse in a COVID unit at Nebraska Medicine. So as I said, they do bring different areas of expertise. I see someone waving to say hello. Thank you so much for joining us this morning. And thanks to everyone who's going to be watching and asking questions. I want to just start by asking each one of you. Tim, we'll start with you. How has the pandemic been impacting you throughout this whole thing? And now recently, how is it impacting you?
Well, it certainly has been, the length of the pandemic is starting to show now. You know, it has created some weariness, I think, in the staff here at Methodist, and I think that is also, that's very difficult to deal with right now, is trying to figure out, is there an end in sight? You know, we all talk about, you know, what life is going to be like after COVID, and trying to come to terms with how long this is going to go on has been very difficult for our team. I can also say that it's been very inspiring to see how they've risen to meet that challenge at the same time, and seeing how morale is right now. But you know, one of the main things I would add to the conversation is just that the length of the pandemic has proven to be a difficult challenge.
Sure, I'm sure. Yeah, the length of it definitely is a piece of it for sure. Dr. V, you've noticed that as well, or what has been your thoughts on that?
Yeah, I think the pandemic fatigue and the length of the pandemic has definitely been challenging. Other things that I'm also noticing is, you know, a lot of my team members, healthcare workers, feeling very stretched thin and fatigued a little bit as well, because we're all pitching in and doing extra hours. And also all of us have families. You know, I have two little ones at home, so not being able to spend a lot of time with my kids. So yeah, it's personally and professionally stretched thin a little bit right now.
I think that's a big piece of it too, is the fact that, right, you all have your own lives as well. We've been hearing, you know, how healthcare workers are kind of our heroes through all of this, but truthfully, you also are parents and spouses and dealing with all of that as well. So Becky, what has been your experience through this, and how has it changed throughout the pandemic in terms of your feelings about what's going on?
I think initially it was a lot of fear because we didn't know what to expect. And, you know, I remember in May and June thinking that this was the worst of it and this was going to be, you know, the biggest wave that we were going to feel. And now fast forward to today and thinking about all the things we're seeing, I guess I feel like I was very naive and back at the beginning of summer, and it's just truly just so overwhelming. And at the beginning I did feel a little bit like I could leave work at work, but even more so now it's very difficult because you come home and you turn on your TV and it's what you're seeing, and you try to go to the store and, you know, most people are wearing masks, and it just feels taxing in all aspects of your life.
Does it feel like there is a little bit of a disconnect, Becky, then, that you're seeing one reality when you're in the hospital and maybe a different one as you live your life or go on social media?
Yeah, I do feel like there is a disconnect, and maybe it's because, you know, a lot of people don't see what we see in the hospital. They don't see how sick people can get, or, you know, they don't have a loved one that's been sick that they couldn't visit. And so they have a hard time understanding what it's like to be on the other side of it. And so it's easier for the other people maybe to not be so cautious, or to think that they're young and otherwise healthy and it doesn't affect them. And it's just that mentality that I've seen a lot is, you know, it's never going to happen to you until it does. And that's where I feel like we're kind of at right now. We're at this tipping point where it's going to come a time where everyone is going to become affected, if they aren't already, by someone that they love or a close friend or themselves are sick.
Yeah, Dr. B, that everyone is going to be affected. You know, we do hear from some people saying, because there are obviously some groups of people who are more greatly affected, but, you know, what would you say to some people who think they are possibly immune or not going to be impacted by this?
Great question. You know, I think in our community, everybody is going to be affected the way the infection rates are going. Even if you're young and healthy, you get asymptomatic infection, you can pass it on to your grandma, grandpa, or your parents. So it's not just about you right now. It's about how do we protect each other. You know, if it's, you know, if you think about like smoking, for the most part, as an example, you're affecting yourself. But when you have this infection, it's just not about you anymore. You're putting others at risk too. So I think that's why it's really important as a community, as Nebraskans, we have to do the right thing and, you know, do those wearing a mask, social distancing, and washing our hands. It's going to be really important to help. And also to the prior question, how our healthcare workers, I think we're also emotionally drained as well. You know, I just, prior to coming on here, I was rounding on our patients on our team. And it's really hard to see some of our COVID patients who have been with us for over a month, and, you know, talking to their family members, and how, you know, young people not recovering and been with us for over a month. You know, if you look at Nebraska data, it's not just affecting elderly. You know, people at all ages are dying and getting really sick and in the ICU or in the hospital.
Yeah, I think that is the important message, that you don't know who it'll affect. Tim, we were talking a little bit about, you know, how work has changed for people. Describe to people what steps are now taken for healthcare workers and in the hospitals that weren't taken before the pandemic. How does it look different when as you're caring for these patients?
Sure. I mean, great question. You know, the first thing I would say is it's very difficult for the teams because of the constant information flow and the changing information. Throughout the pandemic, we've had recommendations from the CDC and other expert bodies that have you know, given us their recommendations, and we've tried to implement to the best of our ability the right thing to do in every situation, and that has been difficult for the team to respond to, because it's whiplash of constant information. Communication is everything right now. So trying to, number one, establish clear lanes of communication and make sure that we are all on the same page as much as is possible at any given moment. Some of the, you know, the practical things that we've seen, we've had to kind of modify some of our spaces. You know, at Methodist Hospital, for example, we have several different areas that have been converted to full negative airflow. And we have a lot of different space that we can utilize. So we have plans in place for, you know, when we hit X number of patients, we can activate certain parts of our surge plan, and working through that. Also, with regard to PPE, you know, making sure that we have clear processes in place to make sure that we are managing that well. That's one of the biggest things, you know, for my team. When I tell them to go into a room, I want to make sure that they have the right things on. So making sure that all of our processes in place for management of PPE, of masks, of gowns, of gloves, and making sure we're tracking that, being responsible wearers of the PPE as well has been critical. There's so many changes that have occurred. This year has been a whirlwind. I would describe it as. Definitely. We're getting used to change every single day, every single hour. I think that's one thing that COVID has shown us is how nimble we have to be as healthcare workers. And at this point, I feel confident that we are gaining good experience with that and that we will continue to be able to handle the challenges that are thrown at us throughout this winter.
Yeah, Becky, he was talking about PPE. One thing I've noticed while talking to some nurses and things recently, PPE was something that came into play really early on. We heard a lot about, in the general public, we heard a lot about, and then it seemed like we haven't heard as much about it, but it doesn't mean it's not still a concern. You guys are still taking a lot of efforts to preserve that PPE. Is that right?
Yes. So, to go into a room to gown up. So we wear a gown that ties at 2 spots in the back. We wear gloves. We wear our N95 and we wear our face shield. And all of those things, with the exception of the gloves, are reused. So we take off our gowns and they go into a special linen pile. And then all of those are washed and then folded and put back away by some of our PPE experts. Our face shields, we bleach coming out of the room and we wipe down and we hang them to dry, and then we use them each time we re-enter rooms. And then our N95s, at the end of the day, we take them off and we have them in a brown bag and we take them to our decon unit, and they sanitize them, I believe with UV light. I'm not sure entirely of the process, and then we use those same masks over and over until they break or their integrity is no longer upholding and will no longer keep us safe. So I think the N95 mask that I've worn the most, I think I've worn it over 20 times, and, and it's still holding on, but I've had multiple break.
That whole process, I realize it's necessary, it's very important, don't get me wrong, but it does sound kind of taxing. Is your job that much harder? Obviously, it's more emotionally difficult right now, but just your job in general, is it harder these days because you have all these extra steps?
It is harder. In even the easiest of scenarios, just if your patient's calling and wants to go to the bathroom, or if you're going in to bring them their lunch, just to even do something simple, you have to do all of those steps: putting on your gown, putting on your gloves, putting on your mask, putting on your face shield. And then, even in the emergency situations where someone needs immediate help right now, that also is a hindrance on getting to them quicker, because yes, you want to help your patient, but you also have to keep yourself safe. And in keeping yourself safe, you're keeping your other patients or your colleagues that you're coming into contact with safe as well. So it is a big barrier, but every day we're learning quicker ways to do things and having extra set of hands on the floor so they can walk around and help tie gowns quicker, all these things that we can help minimize any gaps in care.
Absolutely, Nikki. And I would
we
agree
have Go ahead.
I'm sorry. I was just going to say, I agree that it's a very taxing thing for the team to try to manage. Every time they're in and out of the room, there's a very specific donning and doffing process for the putting it on and taking it off has to be done in a very specific way to make sure that we keep our unit safe, to make sure that we keep the rest of the patient safe, the rest of the staff safe, the rest of the physicians safe. And of course, those people are then going to other areas of the hospital. So we try to make sure that our processes in place are based on science, they're sound, and that we then make sure that we're actually committed to doing that every time. So we have additional people that are in place right now at Methodist that try to help us with those processes to make sure that we are comfortable coming in and out of the rooms at all times. But yeah, very important, and not to be understated is how much extra that does put on the team at bedside to go in and out of the room in such a way.
For Dr. B, we had a couple comments come in regarding schools that maybe this is for you. Says from Kelly, first, thank you from the bottom of our hearts for all you guys do. So that's for all of you for sure. Next, as a teacher and a mother, I was wondering what we could do to help the spread in the school setting. We wash our hands a ton, sanitize, 6 feet distance, mask, clean all the time. Still seeing high spread in schools and staff can run very low. What else would you suggest that might help?
I think other things that might help is as a community, on top of doing those things at school, we need to stay home when we don't need to go out right now. Going to work, going to school, and not a lot, not making sure we don't not doing indoor gathering and outdoor gathering, limiting that as much as possible, and just staying with your immediate family. So I make sure my kids and I, for example, I have a first grader and a 5-year-old, and we make sure that we don't go to play dates, we don't go visiting other people, so they go to school and come home. So parents and in our community, we could do the same to make sure we're not spreading the infection by just limiting them to going to school and coming back right now. I know it's hard, but I think these are some of the things that we could do to decrease the spread. And I also know Thanksgiving is around the corner next week. So it's really important, again, to just spend time with your family, immediate family that you live with, so we don't have indoor gatherings and spreading of the infection. So the mitigating tools we have right now are washing our hands, wearing a mask, and social distancing. So I think schools are doing an amazing job and continue to do that. But I think us as parents can do more to make sure our kids are healthy so they're not taking infection to the community, to other kids, and spreading that.
I think that's a great point. I saw Millard even put out a video today, and it was more a plea to parents saying, and we talk about it, the holidays are coming up. So it's one thing to, take all these measures in school, but if you send your kids home and then they're gathering with everyone, there can be spread that they then bring into the school. So it's trying to hit it on both fronts, it seems like. Someone is asking, how do we prove to people that wearing a clean mask is not harmful in the slightest? So yeah, we get comments, we see on social media, people, almost every time when I put out there that health officials are telling us to wear a mask, I do get at least one comment where it says, I don't trust them, I think it's bad for me. I don't know who wants to address this, but what is the fact, the studies on that, the belief of why masks aren't bad for us and how they're good for everyone right now?
I could start off with that. And, mask, there have been some studies. One of the concerns was, are we retaining carbon dioxide? And there have done studies to show no. And another example is, we look at right now in our hospital setting, we mandated masks across Nebraska. All the hospitals were wearing universal masks. And for the most, we all been very healthy, and that has not been an issue at all. So I think wearing a clean mask is definitely going to be helpful, prevent the respiratory droplets from spreading to others, but at the same time, it'll keep you safe.
Okay. We're getting another question in here. This one, sorry, I was reading through it because it's 3 questions. I'll try to sum up. So number 1, do you have to have a fever or cough first to be concerned you may have the virus? Number 2, my mother-in-law was diagnosed with COVID. My son went into her house without gloves and a mask. He was in there for 20 minutes, standing right next to her. What are the chances he has the virus? And do you think we should do another shutdown? I don't know who wants to tackle any of those at all. I have talked to people on the panel about how they don't necessarily want to get into the politics of what policy should be, but all the other questions, if anyone wants to take the cost question and then the concern about the time and the closeness for that. Dr. V, you were raising your hand on that one.
Sure, I could go with, you don't have to have cough or fevers. There are a lot of different symptoms with COVID-19, including, loss of taste, loss of smell, fatigue, new onset headache, sometimes abdominal, like diarrhea. COVID-19 manifests in lots of different symptoms. I think the most important thing to make sure we pay attention to what our body is saying. And if you do develop any of those symptoms, to make sure you stay home, get tested, and so that you don't expose others.
All right, thanks. Tim, another question on here is, we're seeing the numbers going up. As someone who's working in a hospital, what are the numbers you're seeing that you maybe are concerned with? Or can we try to paint a picture for people about, how this is a concern that it could be too stressful for our healthcare system overall?
That's a very good question. At this point, we're really concerned about the rising numbers across the state. And, although we are doing okay right now and things are, we're able to manage, I think we're concerned about the increase from where we're at. I think it's safe to say that right now we have the highest numbers, or we're kind of at the area of highest numbers that we've seen yet at this point. We could be nearing, as Becky mentioned, a tipping point is, I think, our main concern. Where I would say that at this point we are stretched and we are stressed, but we are not yet to the point of being overwhelmed. But that could happen if, I think we have to be realistic that could happen if we don't do the things that Dr. V has been talking about. So far we're doing okay and we're managing, but that's our real concern.
If I could add to that too, right now,
Sure.
over 900 patients are in the hospital with COVID-19 infections. And if you look at per 100,000 cases, we have over almost 120 per 100,000 cases in our community. Our test positive rate is very high. If you look at our number of beds and ICU beds that are available, they're slowly shrinking away. So if the numbers keep going on this trajectory, we're going to have really high rates of infection and high hospitalization. One thing to remember is when patients get infected with COVID-19, it takes about 8 to 12 days to get admitted to the hospital for majority of patients when they get really sick. So it lags. So if I get infected now and if I get severely ill, probably in about 2 weeks I'll get admitted. So I'm really worried about the trend, and I am concerned that if we keep going this way, we're going to have lots more people admitted to the hospital, and we are going to have more patients pass away. So I think, again, doing those masking and hand hygiene and social distancing is very important now to help us prevent that.
For sure. Becky, with that, we're getting a question in here. I'm going to pull it up right here. Along with social distancing, wearing masks, hand washing, is there anything else that we as a community can do to support our healthcare workers? What would you want people to do to support you right now?
I would want people to, honestly, just like she said, social distance, wear a mask, wash your hands, lead by example, only go out for necessities. The camaraderie around the community that's supporting the healthcare workers, it feels really good. But sometimes how overwhelmed I feel and my coworkers feel while we're at work, doing our best to take care of these patients, really overcomes the feeling of the camaraderie from the community. So I think that the best thing that people can do is to do all of those things so we can decrease our numbers and we can get our hospital system back to the way we were working pre-COVID. Right now at the medical center, we started with a COVID ICU and then a COVID med surg floor. So we had 2 units. And I know our COVID ICU has 24 beds. And we are now up to 10 units one of which is just for patients to go and die, essentially. It's when families decide that they're ready to withdraw care from their loved one. And that's to better help us allocate resources for those other patients who are sick and needing that higher level of care. And it's just very taxing. And we are obviously wanting to take really great care of everyone, but it's hard. We don't have the bodies. We've had mandatory overtime, and I think we are hitting our third mandatory overtime just to get enough bodies in here to take care of these patients. And I just don't want to see it happen to I've been lucky enough that I haven't had to take care of any of my loved ones, or none of my loved ones have been sick, but I'm sure it's only a matter of time. And I just want people to stay home and to wear their masks and make good choices, because that's the best way that they can help.
Becky, with that, in the media, we're sometimes told we focus on the negative, and I want to make sure people know, I asked this question not to focus on the negative, but to make people see and understand what's going on in these hospitals. Can you address a little bit, some of the tough moments you have to deal with when it comes to patients and their families, and also, just how sick some of these patients are getting? Paint that picture for us a little bit, that we can see how tough this is for a number of people.
Well, so, basically every day I'm at work, there's at least one stat intubation, which essentially means that someone is no longer able to compensate without a tube down their throat to help them breathe. And when that happens, it's an emergency. We need to get to that patient right then. Like, they're going to have that tube down their throat in a matter of minutes. And seeing that, I went at the beginning of all of this, that would happen maybe every couple of days, or they were more planned intubations because we saw the trajectory of where that patient was heading. And now having to do that on the spot at least once a shift, if not more times, is very scary for the patient, for us, as the nurses and the providers and everyone else involved. And specifically with all of these patients coming in, we are taking more patients. We're at increased ratios. The Med Center is pulling nurses and other staff from outside of like inpatient units to come and help us, because we are in desperate need of it, which is just crazy to see. You have someone that's been working as a secretary and they're running around trying to hand you things that you need because there aren't other able bodies that can help you because people are so busy. And I see that spilling over into patient care in ways that, because we are so busy with our patients, that sometimes there's a lag in talking to the patient's family to update them, which is obviously very frustrating for the family. And it doesn't make us feel good as the care providers that, we haven't had time to do that because we're trying to provide such good care. And working as a lead nurse, I am usually on the receiving end of a lot of those calls of family members calling in and saying, that they're very upset because they haven't gotten updates. And so that's very hard. It just all is very taxing, and it just doesn't feel like there's an end in sight, despite everyone really coming together and pulling out these resources. Like, every single time I'm at work, I wonder, like, is this going to be the straw that broke the camel's back? Because when I go to our house bed meeting, which is a nurse from each floor comes and sits down, and we talk about where are all the needs at for nurses? Like, where can we pull a nurse to help staff another unit better? And, when we're down 40 nurses, you just wonder, like, how are we going to make this work? How is this going to, how is this ever going to be feasible? And yet we pull it off. But, with the weather changing, like, other things don't stop. Car accidents don't stop. Heart attacks don't stop. Strokes don't stop. Kids falling and getting seriously injured, that stuff doesn't stop. And on top of everything that we're seeing, it's just hard to fathom the direction that we're heading.
Yeah, Tim, I see you nodding quite a bit on this. Similar feelings on that. You can relate to what she's saying.
Yes, it is. It is incredibly difficult to care for critically ill COVID patients, is what I'll tell you. The best medicine is prevention for COVID, and we don't have a cure per se. They're working on vaccines. We're working on different treatments. There are many different treatments that have been developed, and we know much more than we did back in March, April, May. But at the same time, the critically ill patients generally come into the hospital and remain for a very long period of time. So what we do is we provide supportive cares. Eventually, as Becky mentioned, some patients need to be intubated and require a breathing tube and mechanical ventilation. So when you heard people talking about ventilator shortages, part of the reason was we haven't had that issue here. We saw that more in New York and other areas, but what we're seeing is patients stay on the vent for a very long time. And it is very, they're on sedative medications to get them to tolerate being on the vent, to try and make it easier. We're on a lot of different therapies like proning people, which means putting them on their bellies instead of laying on their back, which helps the lungs. So those kind of things over time are very taxing on the patient. Physically, it is not an easy thing to watch for the nurses as they care for these patients, and it's not an easy thing for families to see. I do worry about the trauma that this pandemic will create. It'll leave an indelible mark. The things that we've seen and the things that we have to do every single day. I think this will be something that we remember for years to come because of that.
Is it something, if you could go back to March and tell yourself that we'd be at this point here in November, would you believe it? Would you think that this is where we'd be, or is it something you kind of expected that it was going to be a long haul?
It's been a roller coaster. You see the projections, and a lot of those things there's so many factors that can influence the way that our numbers are going, including, what we do in terms of mask mandates or whatever is going on in terms of regulation. But, the roller coaster has been difficult to cope with, I would say, for our teams, and not just nursing, respiratory therapists, EVS staff, the people that clean our rooms, the people that draw our blood work. It's been difficult for everyone. In terms of what we expected, I don't know that any of us really knew fully what to expect. We took cues from Italy, we took cues from New York, we took cues from other areas. We expected a bigger surge earlier, I think, in the year. And then we did, from what we were hearing from scientists around the country, we expected that there would be more waves, more surges, and that's what we're seeing now. It's just so difficult when we haven't been in a situation like this in recent memory to prepare for what it's really going to be like. All the plans that you put in place, all the different possibilities, plan A, B, C, D, E, F, G, all the way down the line, have to be modified as things change. And it's been very difficult to cope with the fact that things are constantly changing. But right now, I do think, we're talking about that tipping point. And what worries me the most is not where we are right now, but where we could go. And I think it's certainly possible. I think we're doing a lot of things to prevent that from happening, but that really is the fear now.
Yeah, Dr. V, we hear promise when it comes to a couple of vaccines. Tim was talking about some of the therapies and treatments that are being used. It seems like we understand the virus a little more. Can you talk a little bit about what we have learned and, maybe some positive news in terms of dealing and treating with COVID-19?
Yeah, great question. We have had some really good studies that have looked at randomized control study where they looked at what are some of the effective treatments. So some of the things that we do know to use now is steroids. The antiviral medication remdesivir can shorten the course of the infection a little bit, and also giving plasma early on of the infection may help. So there are some tools that we have now. And on a positive note, the vaccines, I'm sure everybody has seen Pfizer and Moderna, over 95% effective. So we're waiting for more information. And it seems like not a lot of adverse effect either. And I want to share that myself and a couple of my infectious disease colleagues, we actually participated in the vaccine trial. I don't know if I got on the placebo vaccine arm, but all of us have stayed very healthy and no major issues. So I think that's going to be really key. Most likely the frontline workers, healthcare workers will have an opportunity to get vaccine in December. And I think that's going to be really important to be able to get our vaccines and help prevent the spread. You know, one thing to kind of highlight is it's not just patients in the community that are getting ill. A lot of our healthcare workers are now getting COVID-19 across Nebraska. So that is also putting a strain on not having enough healthcare workers to work as well. So I'm very hopeful the vaccine is going to be able to help us.
I want to make sure we're introducing all of you for people who are just tuning into this. So we have Tim Horty, who's the service leader of critical care at Methodist Hospital. We also have Dr. Vivekanandan, who is an infectious disease expert with CHI Health Creighton, and then Becky Long, who is a lead nurse at Nebraska Medicine in one of the 10 COVID units, correct? You said 10, right? So we have all of that expertise joining us right now as we talk about this. You know, we are seeing a lot of people saying that they're thinking about you. We are having those comments coming in. And I guess if people are just tuning in, we keep seeming to get the same questions of people are wondering what else they can do to help. So in light of the holidays coming up, I mean, no one wants to cancel their plans or do a virtual Thanksgiving. I think we need to understand that no one wants to do that, but why would you still plead for them to do that, even if it isn't ideal? Why is it so important that we take these steps now, even if it's not something we necessarily want to do? Why is it still important?
Can I start?
Tim, you sure can.
I would just like to share that, you know, I come from a very large family myself, and Thanksgiving and Christmas holidays are to me just one of my favorite parts of the year to reconnect with all my brothers and sisters, my nieces and nephews, all the different relatives that generally come to our events. And, you know, it's going to be very difficult this year. It really is. We're going to have a more intimate, smaller, within our own bubble kind of event. In both cases, I guess my point would be that, yes, this is inconvenient. Yes, this is not what we would want. But at the same time, consider doing that this year so that next year we can have a larger gathering with everyone there at the same time as well. That would be my message, is that, you know, this year we can still celebrate. We can still modify our celebrations so that we're making sure that we're doing so safely. But thinking about next year, thinking about making sure that all the relatives are there next year is what I would ask of the community.
Yeah, I think that's so important. It's what is at stake if we don't take these measures. That's obviously a bigger thing. We have Brent weighing in. We have to think it's important to see your loved one for one day and a holiday, maybe not see them ever again if they were to get COVID and not survive it. And, you know, I think that is what we are hearing. You know, Becky was giving some of those stories as well, Tim too. You see and deal with those families, and maybe for the rest of us that might be far off, that if we haven't had a loved one who's had it or been seriously ill, we may not think about that or think that that's really a component. But you guys talk to these families, you know how real it is that they experience that loss, and how I'm sure for some of these families, it was also very unexpected. We talked about this a little earlier, but Becky, if you could talk about that, you know, not everyone you see is a certain age or has a plethora of underlying health conditions. You're seeing patients of all different walks of life, correct?
Yeah, we are seeing patients of all ages, of all backgrounds. And we're seeing people who were careful in social distancing, and we're seeing people who, were out at social gatherings. And I think one of the things that has stuck with me the most is that, there's so many restrictions, specifically like on our COVID floors, they cannot have visitors unless they are dying. And we have patients who come in for other reasons, like I was talking about earlier, like car accidents, and they're really sick, or, heart attack or stroke. And then they also happen to have COVID once we test them. And so they have to come to this floor, and they have to go through some of the most challenging times in their life completely alone, or, with like a pseudo family, and that's what we become, as the healthcare providers for these patients. We become their family, because we're all that they have, and we're all that they can see right now. And it's hard because, we've seen kids come in and then they have to be separated from their families because their whole family is sick, and they're all our patients. It's devastating to see a little kid walking around alone in their room, and you can't be in there with the child, and their parents can't be in there, and they don't have anyone else. It's just something that you can't fathom, and you hope you never have to see it again, but it is what we're seeing, and it's the reality of the situation.
Yeah, it is. It's affecting so many people. Dr. V, we're talking a little bit about the holidays and about gatherings and things like that. As we mentioned, all of you are people too. You're not just healthcare workers. How does it impact your life? What are changes you're making, and that you would give as advice for other people to do?
Yeah, so this holiday, usually Thanksgiving is a big event in our house, and everybody loves getting together. But this year, it's just going to be my husband and my kids at home, because we want to make sure we do the right thing for the community and keep everybody protected. So I think I like what Tim said earlier, is that we do the right thing this year so we could celebrate next year. I think that's the key. So we could celebrate with everybody in our family. And also to Becky's point about how sick patients are, I think it's important to know that not every bed that we have, it's different. As UNMC or CUMC Bergen, University Medical Hospitals, it's different from when you're in a rural area. For example, we have something called an ECMO machine, where you can take the blood and oxygenate it outside, because your lung is so stiff and you cannot get good oxygenation. Treatment like that are not readily available. So also to remember, resources are limited in those cases. So we have to do the right thing this year so that we could celebrate next year.
I want to talk to you guys about something. I just got an alert on my phone. We just got the new numbers from the Douglas County Health Department. We get updates every day, and they told us there have been 978 new cases reported in the last day in Douglas County. Sometimes they'll let us know that this is actually compiling from other days, and this seems to be just a single day total, and it would again be a record high. We seem to see a lot of record highs lately. When I give you a number like that, when I give you the stats, what do you think? I mean, you're living this. You're seeing the people behind those numbers. When you hear it's going up, what is your reaction to that? Whoever wants to volunteer.
Yeah, I could start. Looking at those numbers, it's going to keep going up, and it's going to affect patients, and we're going to have increased hospitalizations. So I think I can't emphasize enough, this is like the tipping point where we all need to do those mitigating things now, or the numbers will keep going up, and we are going to have increased amount of hospitalizations, and unfortunately people are going to pass away at a higher rate as well.
Yeah, that's important. You say at a higher rate. And that's strictly just because if we cap out our healthcare system, it will start impacting the mortality rates of those being treated. Is that correct?
Of course, yeah. When you're stretched, we all want to do the right thing for our patients, so we're going to do the best we can. But as the numbers go up, you're going to have not enough beds, or other resources might become limited. Example, not everywhere we have ECMO machines. If a patient needed that to help them recover. So you will start seeing higher mortality.
I would say what
Tim,
concerns me the most.
Oh, go ahead.
Sorry. I would say what
no, go ahead.
concerns, well, what part of my concern at that point, and when is our healthcare workers getting sick. The more cases we see, the higher the rates, the higher the percentages. It's not. I think it's important to remember. I think Becky may have mentioned this earlier, that healthcare workers are just regular people out there in the world, and they are at risk of getting sick as well from community contact. I think we've been very fortunate that not many of our staff that have been sick have gotten sick at work. It's been a very, very, very low percentage there. And most of our staff that get sick come from community acquired, community spread virus. And what worries me when we see those numbers is one of my ICU teammates going to be out of action for some period of time? Are they going to be critically ill? I think at this point we've been very fortunate to avoid most of that. But we also worry that we're not going to be there, or that we're not going to be at full strength to care for people that need us the most and need us at full strength. So our mentality is, whenever I see those numbers, we double down, we renew our efforts, and I throw myself at the situation as much as I can, and I try to be the motivator and the morale booster and the positive source of energy for our team. But it does, every time we see those numbers, it does feel like another punch in the gut, that the virus has given us. So it's kind of a dichotomy there.
I gotta tell you, it's pretty powerful to hear you say you reach deeper when you hear something like that. Where does that come from? I could never be a healthcare worker, and I think many of us couldn't, and that's why we're calling all of you heroes. So what is your commitment? Why do you have this? Is it a calling, or how are you feeling right now that you are so committed even during this really terrible time?
Well, gosh, I appreciate you so much in saying that. I don't think of myself as such. I don't think that my team considers themselves heroes. I think that we do feel, though, a calling. It really is a vocation, I think, of helping others. There's a selflessness, I think, to healthcare in terms of, we get paid. It's a job. We do the job to support our families and to support our lives. But at the same time, we do it because we care about other people and making people feel better and healing other people. It really, in terms of where it comes from to continue to fight against this virus and against all the challenges that the virus brings, it's hard to say. I think it's just a part of a lot of us when we decided to go into this profession, our various professions and our various roles. I think we made a commitment to the community. It's not just about ourselves, it's about the greater community at large. And it's important to me that we provide that backbone of our healthcare system at our hospitals to make sure that when people are the sickest, that we are there to take care of them.
Becky, when we hear those numbers too, we know that just based on stats, a certain number of those are going to lead to hospitalizations. So, is that part of it too? You're seeing, obviously, these case numbers mean we're going to see the hospitalizations likely go up if everything tracks as it has been.
Yeah, so when I hear those numbers, I think of two things. I think of what's work going to look like when I'm there next. Because those numbers are so high, and obviously those are going to spill into the hospital. And then the second thing I think of is how much longer, how high are these numbers going to get before it's one of my loved ones or someone that I'm close with that's seriously ill and needs that level of care that a hospital can provide. And what Tim said, about doubling down during this time, I think he is spot on. And for me personally, where I think where that comes from is having had, not during this time, having had a very ill family member. I know what it's like to see good quality care, and knowing that now more than ever, you are that good quality care, you are that family member for those people, I think is where it comes from. Because, you know, with these increase in numbers, no one is immune. No one, if we aren't already there, we have come to a point where everyone is affected. You know, it's someone's family member, it's their loved one, it's their neighbor that they know and are close with. And I think it's coming from now, as the nurse at the bedside, when we look at these people sitting here that are very sick, we see our loved ones and we see our neighbor, because we know that, you know, like I said, if we're not there, we're just about there.
Yeah, Dr. V, I think we're going to probably wrap up here pretty soon. I just wanted to give each of you the chance um, to say again, what is your plea right now for the public? What do you hope they hear out of this? What messaging do you hope they hear, and how do you hope they act going forward?
Thank you. I think for a message from our public is that we have some positive things coming. We are going to have a vaccine that's going to help us eventually, you know, hopefully by spring, we'll have it for everybody, and by December for healthcare workers. So we have something to look forward to, and this is not always going to be like this, but for right now, we need your help. Our hospital systems, healthcare workers need your help. We want to give you the best care that we can. To do that, we need to help stop the spread now. So I ask if you can wear a mask, hand hygiene, socially distance, and also avoid indoor gathering and unnecessary gathering. The way the numbers are going, it's going to continue to go is my biggest fear for the next 6 to 8 weeks. I think anything we can do to kind of bring that down as a community is going to be really helpful.
Tim, what about you? Your parting words, if you will.
Well, I want to thank you for the opportunity to share, you know, our message and experiences with you and the community. It really is important to have that that ability to tell people what's going on and what it's really like. We're so thankful for the community's support. We as healthcare workers, we feel that gratitude. Keep it coming. We need it right now. You know, I want to thank my team as well. They've been working so hard. That's not just the nurses, as I mentioned. It's so many different groups: the respiratory therapists, the environmental services workers, and so on. And our leaders here at Methodist. I really feel like we've been fortunate to have such great leadership through this, and that will continue. I also feel like it's very important to acknowledge that, you know, we are 3 different health systems, but we are all in this together. So to my peers and colleagues at the other facilities and health systems, thank you for what you're doing as well. We really are one team fighting this thing together. The last thing I'll leave you with is, you know, like Dr. V said, do those things so that we can be here to take care of you when you need us the most. We really need the community to do that so that we can be here. Thank you.
I think that is awesome. We've seen that, and even when I reached out to see if we could get everyone to join in on this conversation, all 3 health systems were ready, willing, and able, and wanted to do it together. So I do think that's so important right now. Becky, for you, what are your final words you'd like everyone to hear?
Well, obviously the support from the community is great. You know, all of the kind words and all of the having so many people reach out asking how they can help, it means so much. You know, I just want everyone to stay safe. I want everyone to make good choices. I just hope that, you know, next year we can look at this and think like, wow, look at what we overcame as a community. You know, we did it, and now we can celebrate. We can all be together, and it's just a little blip in the road.
I think we all hope that for sure. Well, thank you so much to all of you. I really, really appreciate you taking time out of your day to do this. And I especially appreciate all of the work you're doing for all of us because as we mentioned before, I mean, you guys are, you help take care of our community during a pandemic and during any other time. And so we need healthcare workers, and hopefully we can have our community come together to protect all of you guys as well so you can care for us. So thank you very, very much and keep up the excellent work. We appreciate it.
Thank you.
Thank you.